Welcome to Johnson County Community College. My name is Michelle Riley, and I'm an assistant professor of dietary management here in the Hospitality and Culinary Academy, and we're really excited to have you tonight to talk about healthy aging. We have several great guests, and we will start off with a presentation from our physician, followed by our dietitian, and then our chef will demonstrate some recipes that you'll get to try. So our first presenter is Dr. Shelley Bhattacharya. She is an associate professor in the Division of Geriatric Medicine at the University of Kansas Medical Center. So we're really excited to welcome her. And then I'm also going to introduce Dr. Matt Taylor, who is a postdoc fellow in the Department of Dietetics and Nutrition, also at the University of Kansas Medical Center. And so he will be presenting after Dr. Bhattacharya. So welcome.
Thank you. Oh gosh, thanks. It's so great to be here. It's a wonderful, wonderful venue. So yes, as I said, thanks for the introduction. Appreciate it. I'm at the Landon Center on Aging at KU Med Center, and we'll go ahead and get started. I have some basic objectives that we'll be covering today: the importance of nutrition in older adults, some barriers to good nutrition as we get older, and what our approach clinically is to nutrition to help guide you to see what steps can we take in the clinical world to help anyone that's having nutritional problems, what those problems are with deficiencies, what the consequences are, and then ultimately who is the team. It's not just the physician, but it's a full team that can help you when it comes to taking care of your nutritional health. So here's a quote that I like. Nutrition is one of the major determinants of successful aging, defined as the ability to maintain three behaviors: low risk of disease and disease-related disability, high mental and physical function, and active engagement in life, which is really the key of getting older, is the quality of life, right? Not necessarily the quantity of life, but the quality of life. So proper nutrition helps to get you there. So that, I think it's a great quote that kind of summarizes why it's so important. So, as we know, nutrition is vital to the quality of life of older adults. Poor nutrition, which we call hypoalbuminemia, how many of you have heard of that term? A few of you have. So that is a measure of protein in your body called albumin. It's a blood test that can be done by your physician. So when it's low, that is called hypoalbuminemia. It's a cardinal sign for higher morbidity and mortality. So mortality means risk of dying. Morbidity is your complexity of disease, your disease burden, you can say. So albumin was used as a blood test to track someone's nutrition. Now it's no longer used as much in the clinical work, in the dietetics world, but it's one of the factors that we can use, plus cholesterol, by the way, as markers of nutrition. Poor nutrition leads to dehydration, increased hospitalization, and of course, increase of health services and disability. It impacts longevity, your nutritional status. There was a survey of over 50,000 centenarians, those that live to be 100 years old, in the US, and they were found to have higher HDL levels. HDL is one of the components in your cholesterol panel. It's the good cholesterol that we say. Exercise, for example, will raise your HDL levels. The higher, the better. Your doctor may have told you, so minimum is 35 for your blood tests, and the higher, the better for that HDL. So centenarians had higher HDL levels, higher vitamin A and vitamin E levels, lower RBC superoxide dismutase levels. These are enzymes that they studied. We don't do this clinically, but this was done from the study that was where this came from. Higher unsaturated to saturated fatty acid ratios versus younger adults, 21 to 99, which means higher proportion of unsaturated fats. So some examples, avocados are a great monounsaturated fat. So they're great. They will not raise your cholesterol. They're a great healthy fat to have, which I'm sure will be discussed later as far as what are some good healthy fats to have. We all need fats in our system. Our membranes need fats. So don't feel like a non-fat diet is the best way to go. That's not true. We all need fats, but we need the healthy fats. And then higher DHA and EPA. Where does that come from? DHA and EPA. Any guesses? So we can get that from fish. So fish oil, a lot of fish oil many people take, and the key to that is knowing how much of these key ingredients is there in each capsule, and the key ingredients are DHA and EPA. So higher DHA and EPA levels versus the younger cohort. Typically, about 32% of adults over age 65 have about 5 servings of fruit and veggies per day, which is not very many. So it would be great if you could raise your servings of fruits and veggies and raise that percentage as much as you can. So some healthy fruits to focus on when you're making those choices are citrus, melons, and berries. And as far as the vegetables, your dark greens, your deep yellow and oranges, and your tomatoes. So when you're picking your garden for this spring and summer, try to focus on those veggies and those fruits to have as far as your low disease risk. Dehydration is a big problem. It's the most common problem when it comes to fluid imbalance in older adults. So as we get older, a normal physiologic thing that happens to our bodies is that we have a decreased thirst sensation. So we don't get as thirsty with the same stressors as we did when we were younger. So we're less likely to take in that fluid. That's my pager, excuse that. We're less likely to take in those fluids when our body is sensing dehydration, which would mean we're more likely to get dehydrated, right? Because we're not taking in those fluids. It's a normal physiological thing that happens to our bodies. So to help combat that is knowledge, A, knowing that, and B, treating that. So keeping, all of you have water bottles in front of you, drink it and then recycle the bottles. But drink your water, right? So at least 8 glasses a day is what we all say, which is a lot of water, but try to do at least 6. Minimum 6 glasses. The more the better, but more water means more trips to the bathroom, but at least try to do 6 glasses of fluids per day. And this is fluids meaning decaffeinated fluids. So caffeine is a diuretic. It will make you urinate more and lose fluids. So think about that. I tell my patients not to do any caffeine after 12 noon because of the nighttime issues, going to the bathroom often during the middle of the night. They found caffeine still sits in your system at bedtime when you take it in the literally after 12 noon. So if you do like your cup of coffee, your tea, whatever, do it in the morning. Do it before 12 noon and then save your decafs for after 12 noon. If you don't like water, you could do the Crystal Lights. You could do the flavored water packets. You could do the Mio little packets, the liquid things that you can add to your water. But try to get your water intake because your ability to have that sensation to drink is lower as we get older. And then ability to concentrate our urine. So our kidneys change as we get older. So their ability to reabsorb that water to keep you hydrated goes down, which means you're peeing out more, which means your blood volume is getting more dehydrated when you're peeing out more. So keep that in mind too. Again, the key is drinking that water. So really try to keep that up. And then if you can't eat, whether it's from an oral problem like dentures that aren't fitting, not having dentures, problems chewing, whether it's a depression issue, whether not wanting to eat, being by yourself, whether it's a memory issue, forgetting to eat, not able to swallow, which is a common progression of dementia as dementia becomes more severe. And medications. Medications are huge. That's one of our biggest targets is looking at medications, not just individual ones, but interactions. So big Benadryl is a huge culprit that's out there. Anyone can buy Benadryl. It's in Tylenol PM. The PM is Benadryl. Advil PM, the PM is Benadryl. So all of that, so that contributes to dry mouth, which can really affect what you're drinking, how much you're drinking, increase your risk of falls. We avoid Benadryl with, if I have one thing to say about medications, it's avoid Benadryl, and look at how your medications are affecting what you're eating and drinking. If you're losing your appetite from your medications, you should change your medications. If you're finding you're not drinking as much, you're losing your thirst, that quench, that need for drinks, you should change your medications. So think of what could be causing you to eat and drink less. Here are some barriers. Xerostomia means dry mouth. So the medications, like I was saying before, the Benadryl, one of the major side effects is dry mouth, poor dentition. As we get older, our gums recede. So the dentures that may have fitted well 10 years ago may not be fitting well now because there isn't as much support for them to cling on to. So getting them refitted. Altered taste and smell. That again could be from medications that could be doing that. Or just your physiologic changes that are happening in your body. Limited mobility, not being able to get out to the store and get the food that you want. So the food that you're getting is someone else's, they're bringing you the food, or it might be from a facility. Maybe you're in assisted living or independent living or nursing home, so you're reliant on them. So mobility has a big factor in the food choices that you're getting in. Dysphagia is problem swallowing. So if you have problems swallowing, you're not going to eat much. Medications we talked about, and then medical conditions, right? So we often are strict when it comes to diabetes, for example, really bringing down that hemoglobin A1C, really limiting your sugars, but that can have deleterious effects where one starts to not eat. They're losing weight because we're so strict on those sugars. So really, I tell all my students, look at your patient first. If they're losing weight and their blood pressure is high, we can treat their blood pressure, but you gotta have them eat. You can't just tell them a low sodium diet and send them out the door with no other guidance. So really balance, if your blood pressure is high and you find that you're not eating anything because you're worried about that blood pressure, tell your doctor, they can always treat that blood pressure, but you've gotta eat. That's much more important than your blood pressure because we can help bring that blood pressure down. So that balance is critical. And that's where those chronic medical conditions comes in. Then loss of appetite. Lots of things can trigger that. Cancer is one where you often can lose your appetite. Medications, again, make you lose your appetite. Losing a loved one, depression, that social isolation can contribute to that too. 80% of those over age 65 have at least one chronic disease. By that, I mean high blood pressure, diabetes, arthritis. So a disease that lasts years and years is considered a chronic condition. Half have two. So they have found that having a healthy diet can prevent and manage these conditions, which is why it's even more important. And then as we get older, we have decreased hunger and early satiety. So we get fuller sooner. So we're not taking in as many calories as we did before because we're fuller sooner. And then our conditions can make that worse, our chronic conditions. So they found that if you eat with others, you're likely to eat 23% more. So think about that. If you're seeing a loved one that's losing weight and they're by themselves, try to get them out. Even like congregate meals with Meals on Wheels, for example, is a way to get people together. But you're likely to eat significantly more, 23% more when you're with other people. This gives you your how many, as you get older, how men and women, how much less they eat as they get older. So men in their 80s eat about 1,000 kilocalories less than when they were in their 20s. And women eat about 600 to 800 kilocalories less than when they were younger. So in general, as we get older, we tend to eat less. Multiple reasons there. So we look at weight loss as far as trends, because by not eating, you're losing weight, and that's a red flag for us in the clinical world. So a weight loss of 5% or more in 1 month, or 10% over 6 months is a red flag for us, where we're really going to ask you about what's going on at home and how can we help you. So when you're looking at your weights, keep track of it. That can be your graph also. And these are your red flags. And when you hit those red flags, that leads to functional limitations and then increased hospitalizations. So things that we ask is, have you lost more than 10 pounds in the past 6 months without trying to do so? That's key. It's unintentional weight loss. All right, if you're trying to lose weight, it's fine. We say no more than a pound a week is what you should be losing if you're trying to lose weight. So it's unintentional weight loss. Is your BMI under 20, your body mass index, which is kilogram over meter squared, so weight over height, basically. Is it under 20? If yes, we need to dig further. And here's a way to dig further. It's called Determine, which is online. You can just Google it, and then you'll find these are questions that you can ask yourself to see if you have a high risk for nutritional deficiencies. So you can see there are 10 questions there. We have yes or no answers, and it has a score at the bottom. So if you have someone that needs it, or if you think you could benefit from it, feel free. So why do we care about poor nutrition? Like, what are some syndromes that can come out of it? What are some problems? So anemia comes out from having low hemoglobin. You're not getting in enough iron. That gives you cardiac problems, and it's problem with having too much output in your heart. A lot of work for your heart to do when you're having less hemoglobin in your blood. As a result, you're fatigued. You have low energy and depression. And then there's a breakdown of what percentage, how common that is, just where we are nationally as far as the relevance of that disease in the 65-year-old and the 85-year-old group. B12 deficiency. That's something I see pretty often in my older adults. I check it once a year on everybody. You want to be at least 500 or higher for your blood level of vitamin B12 if you're 65 and older. 500 or higher has been found to help with cognition, how you're thinking, and also your gait and balance. Lots of dietary sources of B12 that are meat and non-meat. I'm a vegetarian myself, so a big source is meat. So if you have a vegetarian friend, look up and see how they can get their vitamin B12 sources. You can also get supplementation over the counter for vitamin B12, but it's really important as we get older. Calcium. Calcium's big, right? Osteoporosis, osteopenia. Who's heard of osteopenia? A lot of you have, great, which is early bone loss, right? All of this is done by a bone density test. So low calcium, low vitamin D will lead to osteopenia and osteoporosis, which ultimately can lead to a fracture after having a fall. So that's why, and that has a 20% mortality within 12 months, a hip fracture. So the whole idea is to prevent the hip fracture from happening. By 2020, next year, half our population over age 50 will be affected by osteoporosis. That's huge, huge. Vitamin D is really a growing supplement, I'll say, but now it's found to be more of a protein, which means it has lots of benefits throughout our body, not just for our bones. So you want to get your vitamin D level checked annually, and you want it to be at least 30 for your number. And you will get, you'll know what your number is, and they'll decide, your team will decide whether you should get once a week therapy or once a day therapy for vitamin D, depending on what your level. But that is important, because that will affect your risk of falls by helping your balance. So better vitamin D, better balance, fewer falls. And there's that 20% mortality within 1 year after a hip fracture, which is big. And then higher risk of nursing home admission when you have lower vitamin D levels. Sarcopenia happens with protein deficiencies. That's muscle wasting that happens as we get older, which will be discussed later, soon. And then with dehydration, hospitalization. And then, of course, ultimately, death when it becomes severe. So colon health is improved when you have good fiber, reduces irritable bowel syndrome symptoms, and colon cancer risk. So a plant-based diet has found to be protective as far as colon cancer. And as you may know, red meats increase the risk of colon cancer. So try to avoid the red meats and have an increased proportion of green, of a plant-based diet. And we'll go through both today of some plant-based options and some meat options. So you need unprocessed grains to maximize that transit time and lower exposure to toxins. What that means is you want to have those grains to help push things through. So you want to have some insoluble fibers and some soluble fibers that can help push things through your colon and get it out. Some soluble fiber dissolves in water are given their oatmeal, fruit, psyllium, which is in things like citrusel, psyllium, and barley. Binds to cholesterol and gets it out. So it lowers your cholesterol. That's why oatmeal, we talk about oatmeal lowering cholesterol. This is why. It binds to cholesterol and you poop it out. But it does increase gas. So you can have some, gassy issues with distension. Then insoluble fiber does not dissolve. So wheat, rye, your bran, and your veggies, they should not give gas for the most part, and they don't dissolve in water. They'll just push right through. So the skin of your fruit is what's doing that, meaning the skin of the apples, the skin of the pears, the skin of the tangerine, the white pieces around the tangerine. That's all going right through to help push things out. So things that you can do if you're finding you're not getting enough protein, that you're losing weight, you're not eating enough, protein shakes are an option. Don't do this as a meal replacement. Do it as a snack, because they fill you up and you're not going to eat real food if you're full from the protein shake. So have them as a snack. Remember, they're high calorie, high protein. If you're trying to lose weight, this is not the answer for you because they are such high calorie, they're dense shakes. Come to these programs, of course. And then get dietetics involved. And they can help you. They'll do a consultation with you. They'll look and see what your menu is, what your typical menus are, and help to maximize that. The environment, look at, can you eat with someone else? Can you get the food that you want to you? There is a lot of online stuff going on. Is that an option? Meaning getting food delivered to you from the grocery stores, having pickup. Walmart now does pickup where you go there, the food is ready for you, you pick up the food. Communication with your team. Talk to your nursing staff, talk to the dietetic staff, see how we can improve our caloric intake. Meals on Wheels is an option. That's on a donation basis. It does not, you can't do a diabetic diet, you can't do a hypertension diet, but at least it gives you a meal that you can have and keep for tomorrow, that you can eat half today and the rest tomorrow, for example. But at least it's an option. It's food there that's on the table that you don't have to cook. So you can do it twice a week, 3 times a week, 5 days a week, whatever suits you. So in summary, nutrition in older adults is vital. Really try to avoid undernutrition and unintentional weight loss. Look for factors that could be worsening appetite, mood, dementia. Thyroid problems can affect how much you're eating and how well you're metabolizing. Of course, medications, and then chronic diseases. Look for barriers. Or do you have any barriers to getting food? Is money a barrier? Is there a way to get it cheaper? Is transportation a barrier? How can you get there and come back? These are my references. Thank you all.
All right, thank you, Dr. Bhattacharya. That was a nice introduction here. So I'm a researcher at KU Medical Center, and I'm classically trained in nutrition and do most of my research in nutrition and brain health. But I have recently made a bit of a shift. I still do Alzheimer's and brain health, but some of my research has shifted now into how our body composition, muscle mass, things like that might help to affect our brain health in a way. So I'm going to talk a little bit about sarcopenia, which was brought up in the previous presentation. And also I'm going to kind of put a little bit of brain health in there. So since I'm a brain researcher, I can't help but talk about it. So anyway, so when we think about healthy aging, the World Health Organization has put forth a definition. And basically what they're saying is that we want to maintain our health, our well-being, our function throughout our entire lifespan. And so thinking about this, I want to think a little bit about how we can do that from a physical perspective and how can we do that from a mental perspective. I see my graph looks a little bit funny, but this is a projection of how many people are going to be over the age of 85 and 65 up to the year 2050. And these numbers on the left are in millions. So we have an expectation of somewhere between about 60 and 80 million people over the age of 65 by the time we get to 2050, which when we think about where I do my research from Alzheimer's perspective, that's a pretty significant number. It's grown drastically, and so that's, healthy aging. How can we find ways to prevent chronic disease prior to the onset of that as we get older becomes really important if we're thinking about this from not only our individual health, but just health care on the entire economy and overall well-being of the country. And so the factors that I'm going to briefly touch on, physical activity, because we focus a lot on that at our Alzheimer's Disease Center here at KU Medical Center, and then also clearly nutrition, since this is a healthy cooking and eating presentation. So I want to bring up sarcopenia, which was previously mentioned. Are any of you familiar with that term? Have you heard of that? So sarcopenia is a condition where due to nutritional factors and physical factors that as we get older we become more frail. So people think of sarcopenia as being sort of a condition of frailty. And if you go beyond frailty, it's as we continue to lose muscle mass and perhaps lose weight in frailty, that's what we think of as being sarcopenia. So it's how once you reach frailty, it's that continual kind of drive down where you have loss of muscle mass. And this can be due to a handful of things. And there's this phrase out there called anorexia of aging. And basically that means when we think about anorexia, we're not thinking about the eating disorder anorexia, we're thinking about unintended weight loss. And that can be due to changes in appetite, just not having, that hunger mechanism that's the same anymore. When this happens, there's other factors that go into it. There's emotional factors, a lot of various things that may be affecting us as we get older. And whenever we look at sort of the average of the country, once people age from the age of 40 to 70, by the time they've reached 70, their intake is somewhere around 25% less than what they consumed at that younger sort of middle adult age. So this then becomes potentially a factor for other diseases and having this frailty issue. It may be just due to the fact that, you just eat smaller meals. You don't really feel the need to eat a whole meal, or, maybe not snacking on things that are, nutritious. So there's a handful of things that can go into it. And I see I was supposed to have slide headers on this to tell you what we were talking about, but I see that they're not on here. So this slide is basically about protein, and I'm sure you've heard a lot of talk about protein. It's marketed pretty heavily. Whenever we think about the average American diet, most people aren't short on protein intake. We usually overestimate how much protein we actually need. But in older age, there's actually physiological reasons to eat more protein. And one of the reasons why we may have some of that muscle mass loss in older age is just due to the fact that we're not quite as good as taking the protein that we eat and turning it into that muscle that, that would be stored on our body. So when we think about the average human, they probably need about 0.35 grams per pound of body weight in protein, which, if you weigh about 150 pounds, it's probably somewhere around 55 to 65 grams of protein. That would be considered adequate. If you're more active, you probably need more than that. But when we get older, once we hit 65 or older, our needs go up to somewhere around 0.5 gram of protein per pound of body weight. So that means if you're 150 pounds, that now you need about 75 grams in order to make up for that inability to make muscle as well as when we're younger. There's been a lot of studies on this, and a lot of studies showed that if as an older adult continues to eat that lower amount of protein, and what usually ends up happening is they eat plenty of protein throughout, early on in life, but as they get older, that protein intake decreases. So if they're eating somewhere around that 0.35 grams of protein per day, that they have somewhere around 40% more muscle mass loss than the people that eat eat a half a gram of protein per pound of body mass. So it shows just sort of how important getting plenty of protein is whenever we hit the age of about 60 or 65 or older. So the best sources on my list would be fish, if you think about salmon, because they're loaded with lots of nutrients. Tuna is a good source as well. I only put 2 up there as examples. I have no qualms against any type of fish. I think we don't eat enough fish, so I suggest if you have a favorite that's not up there, continue to eat that. Poultry is a great source. Chicken, turkey, like birds, that white meat, and even some of the dark meat from chicken and turkey as well. Nuts and legumes are great sources of protein as well. We just need to remember that they're not complete sources of protein without a grain to complement that. So if you do eat, like lentils or peanuts or something like that, peanut butter, that grain sort of making that peanut butter sandwich helps make that a complete protein. Dairy is a great source, so low fat, always recommend low fat dairy. And eggs are also a great source of protein as well. And this one is supposed to say the combination of protein and exercise. So we are really focused on exercise at our Alzheimer's Disease Center in its ability to help prevent Alzheimer's and dementia, and also helping to sort of negate some of the negatives that are seen once people have dementia. And so a lot of research shows that if you get plenty of protein in and do exercise, that is even more powerful than just one or the two on their own. So always important to stay moving if you can as well. So this one is meant to say antioxidants, and I was going to ask you what has antioxidants in it, but clearly it's fruits and vegetables since you've already seen it. Antioxidants are really important to help fight off free radicals. Have you heard of that term before? So free radicals, they kind of rummage around through your body and they cause cellular damage. And if you don't have enough antioxidants to sort of offset that cellular damage, and basically what they do is bind with those free radicals and chaperone them out of the body. If you don't have those in high quantity, then they can cause some inflammation and things like that may also be driving down muscle mass. So fruits and vegetables, not just protein, so we think about protein as muscle building, but even fruits and vegetables are really important for maintaining that muscle mass as well. In my opinion, I think some of the greatest sources are going to be your green cruciferous vegetables, so broccoli, kale, chard, anything that's green, leafy, has kind of some sprouts to it. Those are great sources. Yellow and orange vegetables, so carrots, you can get green, red, yellow, orange, peppers, sweet potatoes, so anything that's got that bright sort of, tomatoes even, they have that bright sort of red, orange, yellow color. And then berries are, I think, the most powerful fruits you can consume. So blueberries, blackberries, raspberries, even strawberries. Anything that's a berry is a great source of antioxidants. So 2 other nutrients that that I think are really important for maintaining, physical function and muscle mass are vitamin D. So that was briefly brought up as well. So vitamin D, if we look at studies, those that have higher vitamin D status usually have better muscle mass and better body composition, and have a little bit more functionality than those that have lower vitamin D status. And so from this perspective, it's kind of hard to get vitamin D in the diet from a natural source. Most of the food items that we consume that have vitamin D in them are fortified, meaning that the vitamin D is added to it. So like milk, I think most people probably just assume when you see vitamin D milk that milk is just naturally high in vitamin D, and we actually add vitamin D to milk. So, those are sources, but good natural sources would be wild fish. And then I think the supplemented foods are good as well. And then a lot of people actually, I think I'm not huge on supplements, but I think if there's a couple that I could recommend, vitamin D is one for sure. And then I'm also talking about omega-3 fatty acids. I think fish oil is a good supplement as well. So omega-3s are important for building muscle and maintaining muscle mass. They have anti-inflammatory properties, so they help us kind of help our immune system work better and flush out any type of damage that can be caused by excessive inflammation. And so I think fatty fish, these are going to be great sources. So salmon, tuna's got it as well. Mackerel is another great source. Fish oil is another source that I think a lot of people tend to take. And then from a plant-based perspective, walnuts, chia seeds, and flax seeds are high in omega-3s. And if you happen to take vitamin D or consume vitamin D in the diet and omega-3 together, that may have a greater impact on maintaining that muscle mass than if you just take one or the two by themselves. And so from a brain perspective, sort of shifting into that away from sarcopenia, they kind of go together though. So I think one of the things that's most interesting is that what we're learning is that what's good for the heart is good for the brain. Maintaining a healthy muscle mass and maintaining a sort of activity level that's higher are really important for making sure that our brain also ages well. So not just thinking about our body, but if we do have a healthy body, that our brain tends to sort of follow with that as well. So one of the things that we want to do is try to control blood pressure, avoid diabetes, those types of things, and reduce our risk of cardiovascular disease through good nutrition. And you've probably all any of you heard of the Mediterranean diet? So the Mediterranean diet's a pretty key buzzword right now, and we're actually doing some research on that at KU Medical Center as well. And so there's some really good evidence that the Mediterranean diet is healthy for the heart. So we think that what's healthy for the heart is healthy for the brain. There's some really good evidence that points to the fact that may be the case. So we're doing a clinical trial at KU Med to see whether or not that we see that. But there's some really good sort of observational data showing that as people follow that diet, they tend to have healthier brains and healthier heart. And this is just what the Mediterranean diet looks like. So if we look at the base, and this is supposed to sort of mimic what folks in, like, say, Greece or over in the Mediterranean area are eating. And they tend to have some of the best health outcomes in the planet. So we've sort of thought, well, maybe we should model our diet after what they're doing. And they base the foundation off of whole grains, eat a lot of vegetables and fruits, consume beans and legumes and nuts at a pretty high rate. They consume a lot of olive oil. Not so much cheese, but if you go to, like, Lebanon or some of the Middle Eastern countries that kind of fit there in the Mediterranean area, they put yogurt on everything. So yogurt's a good one. And then fish, poultry, eggs, and very little sweets and red meat. Another nutrient that I want to talk about, I guess not a nutrient, but food group, is dairy. And dairy is one of those things that's kind of polarizing. Some people are for it, some against it. There's actually a lot of really good research showing that it's actually really beneficial in the diet. And so there was some research done at our institution that showed that the more dairy that people consumed, they actually had higher levels of glutathione in their brain. And glutathione is the brain's antioxidant pathway. So basically, it meant that if you drank more milk, that you had more defense of your brain tissue than if you consumed a lower amount of milk. We did this through 2 studies, and we saw the exact same thing twice. So now we're doing a study where we're actually asking people that drink a low amount of dairy or a low amount of milk to drink milk for 3 months and see what, whether or not we can change their brain antioxidant levels. So sort of interesting there. And so this is just my plug on some of the studies that we have going on if you're interested in that. So we have our what we call our NICE study, where we're looking at nutrition interventions in brain health. And then, as I just mentioned, we've got this milk study going on as well. So anyway, a couple of ways that if you were interested, you could get involved in. And so I think we're going to do kebabs tonight. So I was just briefly going to mention it. It looks like we're going to have some protein from the chicken and some good colorful vegetables in there just to kind of round out what we talked about here. So now we get to the fun part. So.
Perfect. Thank you, Dr. Taylor. Awesome. So now I would like to welcome Chef Mick Milster. He's the director of the hospitality management programs here at JCCC, and he has been a culinary educator for 25 years, so we're happy to have him.
Hi, everybody. So this is going to be pretty cool because I got a little mini meal coming out for you guys to sample. A couple of our students are up there. I was not exactly sure when these guys would be done, so we've been doing a little game of timing, and they're actually plating that up now, and they'll be bringing it out and passing it to you guys while I'm here talking. It's pretty cool. I'm a chef by profession, and chefs a lot of times seem to be kind of anti-nutrition. And at one point in my life, I was overweight. I smoked cigarettes and drank too much beer, and I realized that that wasn't going to cut it if I was going to live a long and rewarding life. And now I'm 58 years old. I'm normal weight. I'm 5'9", and I weigh 157 pounds. I absolutely hate exercise. And I solved that problem by realizing that there were some things that I did like to do. I like to ride a bicycle, and so I do that a lot. I don't think that's exercise. Going to the gym and lifting weights is exercise. And I force myself to do that a couple times a week too, even though I don't like it, because I want to be ready for crashing my bicycle without breaking things. I do drink a lot of milk, by the way, and so I'm hoping that helps a little bit too. I read an interesting article not too long ago that said, I believe you mentioned people breaking their hip and the low the chances of recovering from that being not too good. A study showed that a lot of people who fell down and broke their hip actually broke their hip and then fell down. That's how weak their bone structure gets. So that, you know, if you start to trip or something, the bone actually breaks. I don't know if you have heard that, but it was a study that I read. I do have some background in nutrition. I don't claim to be a doctor or a dietitian, but I taught in the Department of Nutrition and Dietetics at St. Louis University for 12 years. So I was teaching dietitians and future physicians how to cook, and I'm going to try to share with you some of the ideas that I had about that today. Also of relevance here, I hope I wasn't picked for this just because I'm an old chef. Wasn't the deal, was it? We got young chefs around here. I noticed they got to do other things. But I also, for a very, very short period of time, I was a consulting executive chef for one of the largest senior living community organizations in the country. They have these large senior living facilities in major cities all around the country. And one of the things that I found and sat there and told them was, your food doesn't have any taste. Everything is bland. And they were all, oh, but we can't let them have any salt. And food without salt in it doesn't taste good. And I agree with you totally. I have just a little bit of high blood pressure, and my doctor said, you got to quit eating salt. And I said, no, I'd rather die. Give me a pill. I'll take a little pill to keep my blood pressure where it needs to be. I don't want to eat bland, nasty food. And I finally just said to these people, look, I've traveled to some of these places, and I'm looking at your dining rooms, and I'm seeing old people that are sitting there dying because they won't eat. She's 98 years old, and she's dying because she won't eat, and you won't let her have a little sprinkle of salt? That's not smart nutrition. Another piece of advice, when it comes to nutrition, don't sit there and be paranoid about what you should not eat. think about what you should eat, and eat some of it sometimes. The other cool thing about doing that is that we know from scientific studies that probably over 99% of our eating behaviors are learned. That means that if you are a person who doesn't like liver or broccoli, it's not because you were born that way. There was something about the way your mouth is that you don't like liver or broccoli. Somehow in your lifetime you learned that broccoli and liver is icky, and those are actually two very healthy foods. And the interesting and cool thing is you can learn different. You can actually teach yourself to like something that you didn't like. And sometimes you tried something at some point and you didn't like it. And you try it again, maybe prepared a different way, and you do. Brussels sprouts, that's happened to just recently. You know what? People used to boil the ever-loving heck out of Brussels sprouts until they were just a stinky, nasty mush. And now we've discovered that if you know what's really good? You cut Brussels sprouts in half and deep fry them in olive oil. Man, they're the bomb. Sprinkle a little Parmesan cheese on them. I mean, they'll make you want to jump up and slap your grandma. It'll be so good. And it's healthy. And again, that's that Mediterranean diet come in. That's olive oil. It's also, Brussels sprouts is a cruciferous vegetable that we weren't mentioning. Dark green cruciferous vegetable. So what you have here that they're passing out, and please feel free to dig in, is a little example of what I think is a reflection of the kind of food that we would like to see people eating. You'll notice that the little thing that you've got there. Hey, Michelle, did she get the vegetarian one? You got it. Thank you. We have one vegetarian person. We made a special one. But I do agree with the notion of a largely plant-based diet. This represents that. It's not vegetarian for most of you guys. There's some chicken there. But you've got green vegetables. You got yellow vegetables. You got red vegetables. You got a lot of protein, which you were talking about, right? Because you're getting protein from a couple of different sources. You're getting protein from the chicken itself, and also the soybean and navy bean hummus that's on there is very high in protein. And again, if you looked at that pyramid, those are the ingredients, and then the wheat from the garlic naan that I have there. So you'll also notice that there's a lot of flavor to this food. It's not bland, it's interesting. And food should be interesting, it should be exciting, and there should be a lot of layers of flavor. A layer of flavor that I brought, and I didn't use this in what you're eating, but I love this stuff. It's called Cavender's Greek Seasoning. You can buy it in any grocery store. There's nothing magical about it, and there's also, as far as I can tell, there's nothing at all Greek about it. There's nothing particularly Mediterranean diet about it, but it's a conglomeration of different junk that's in there that whenever I taste food and I say it's meh, and I don't feel like, I'm talking home cooking, I'm not talking when I'm being a professional chef, I can just sprinkle a little bit of this on it and make it flavorful. So if anybody is trying to learn how to cook or become a better cook, and you just feel like some of the things that you make just kind of aren't as good as you get other places, a lot of times, sprinkle a little bit of this stuff on there and it'll make it taste good. I really like it. I had a bunch of fellow chefs to my farm a couple of years ago for a deer hunting trip. And I brought this stuff along because we each took a turn cooking something, and I started sprinkle that on. And man, they gave me a razzing about that. You're a chef and you're using, what is that junk, you know? I got emails from all of them a couple of weeks later. Man, I put that essay on everything. So it's actually a really convenient product to have. All right, so you'll notice you got your green sheet there that's got some directions on it. And it's directions. You'll notice I didn't give you a thing that says you need to measure things out. Sometimes that's important. Other times I think it's important to just feel comfortable in the kitchen, like, man, I could go in the kitchen and anybody can make a kebab out of just about anything. Buy some skewers. You can use leftovers. I do that frequently. I have bits of junk laying in my vegetable drawer, man, I get those out of there, skew them up, put stuff on there. One of the things that makes what you're eating here a little bit more interesting is that I actually seasoned and flavored those 4 different components on your kebab differently. So the chicken was flavored one way, the peppers a different way, the green squash a different way, and the yellow squash a different way. And they kind of all blend together with the flavors from that soybean and white bean hummus and the Aleppo pepper oil that I provided you with. And so I'm not going to show you how to do all this stuff, but I do want to show you that it's very, very easy to make hummus. And hummus is a very highly healthy food, and you can make it out of anything. So hummus traditionally is made out of garbanzo beans, or some people call them chickpeas, with tahini, which is pureed sesame seeds, and usually salt and olive oil. But you can make it out of virtually any kind of bean. And what I'm making mine out of, and I even brought my own small food processor so I could show you a demo of doing this that you could do at home. And I just bought some frozen edamame or soybeans, and I cooked them in a little bit of water. Cooked them for, I don't know, about 10 minutes. But again, not by a recipe, but I just put them on the stove and cooked them until they softened up for me. I got canned white beans. And again, you notice I didn't measure. This is not one of these deals where I had this stuff pre-measured. I just got some. And here's the point that I'm making. This one thing that I gave you guys, and I hope everybody liked it, was a Mediterranean flavored thing. But how easy would it be to take the exact same ingredients that we had there and change them all up and make it Southwestern? We could have put a little bit of a spicy pepper or Polano pepper on there. We could have used chili powder and more cumin. You follow what I'm saying? You could just change the flavor profile of it very easy, including to suit your mood. Maybe have it with some rice or something like that. And this hummus type thing, you can make a bean puree about anything. I just said, what if we were doing something like Southwest American? What if we did a black bean puree? That makes sense? So you can just about do anything. So anyway, I've got, again, not really pre-measured. I just sort of threw some in. I might as well just use it all. But that's some of the sesame paste. I'm just going to use some of my magic seasoning instead of salt. It's got salt in it, so. And this is just basically all I did when I made the one that you guys just ate. Put that in there, turn it on. And then a lot of times I like to pour the olive oil in as it goes, and all I'm doing with the olive oil is I'm going to eyeball it until it looks like it purees nice and smooth and doesn't look chunky. Stuff gets thick. It's not a very powerful food processor. But there you have it. It's just that easy, and I just made essentially the same thing that y'all are eating. And that's quick. The Aleppo pepper oil I made the same way. I put the peppers in there, I put some garlic in there, I smushed it around and ran it in this machine. And by the way, I'm just as lazy as I can be. I didn't bother to wash the machine in between making the two different things. I figured if one would season the other just a little bit, right? Here's my last piece of advice that I think is really smart. Sometimes trying to figure out what's healthy to eat and what's not healthy to eat can seem challenging. And sometimes you're not really sure what to do. But part of the secret is if you can go to the grocery store, shop the edge of it. Get your food from the perimeter of the grocery store rather than the middle of the grocery store, and you'll be eating fresh food rather than processed food. And we know in general, and don't get me wrong, I'm not against processed food, but in general, we know that you're better off eating that stuff from the perimeter, and you're better off, if you can, cooking for yourself than opening boxes and cans. That's for sure. All right. Well, that's what I got, guys.
Thank you, Chef Milster.
Absolutely.
It was great. Hopefully everyone enjoyed the samples. We are really excited that you came out tonight. We hope everyone will join us in April. The topic for April is going to be diabetes and looking at diabetes prevention, and so it should be really great. I believe it's April 3rd. It's the first Wednesday in April. So we will put more information out about that one as well. So thank you guys so much for coming. We really appreciate it.